Let's pause briefly for a moment and go back in time. You may recall Call Clegg back in April. We spoke to Sylwia in Northolt.
I am a mother of a 8-year-old girl, unfortunate enough to have a very rare blood disease called aHUS. Just to explain it in simple terms, it leads to blood clots forming in a blood system. A new miracle cure now is available called eculizumab, and Jeremy Hunt won't make it available on NHS, despite the recommendation of its own rare disease experts.
A week later, the Deputy Prime Minister had this to say.
Well, there's good news. I've written to Sylwia, and the good news there is the NHS is prepared to provide this medication for that condition on an individual basis. So what Sylwia needs to do, and I've written to her,
so the child will get the drug.
Well, that depends, of course, on what the judgment is on the individual case for her child, and that, of course, I don't know. So what I've written to Sylwia and said, get in touch with your specialist to make the application to the NHS, and she may well turn out to be lucky.
And to prove that this programme, but more importantly, the Deputy Prime Minister in his office does get things done, the news gets better, notwithstanding the severity of this young woman's condition. As a result of Mr Clegg's intervention, the aHUS, or aHUS UK Patient Family Support Group, will meet with Health Minister Earl Howe at the Department of Health later this month. And indeed, the woman who started it all off, Sylwia, would like to thank Nick Clegg, whose intervention has made this meeting possible. The patient group has also been asked to address a special meeting of NICE, which is taking place actually today. So, good, Mr Clegg, thank you, sir, for all you've done.